Hello everyone, and welcome to a lecture on visual methods for FMHU5003 qualitative research methods in health. My name's Dr. Justin McNabb. I'm a senior lecturer in the discipline of behavioural and social sciences in health in the School of Health Sciences, Faculty of Medicine and Health. What is my business lecturing to you and teaching in this unit? Well, I have lectured in the School of Health Sciences for some 5 years now in research methods, particularly qualitative methods, at undergraduate and postgraduate level. I've also taught a health promotion unit for a number of years in the school. And before that, I taught into the Masters of Health Policy for the School of Public Health. And before that, I did many years of research using qualitative methods in health and community service evaluation and HIV and AIDS and various other things like that. So I'll now share the slides with you for today's lecture on qualitative research methods, visual methods. So this is lecture one, part one of this lecture, visual methods in qualitative health, with a particular focus on, I guess, some examples in health later, but first some general comments. So some learning objectives for these lectures. Hopefully by the end of these lectures, you will understand what visual methods in research are and qualitative research. You will know some types of visual qualitative methods that we can use for health research. Sorry, that should say health research there. And I'll give you some examples of these methods in practice as well. Okay, so just first of all, to get us into this frame of mind for qualitative visual methods, first of all, I just want you to close your eyes, have a bit of a meditative moment. Some of you, like me, might have an inner voice in your head that you sort of have going all of the time. So perhaps if you have one of those, start focusing in on that. But also think what else is in your mind there. Do you also have visual images that go with that inner voice? Do you have a shape that goes with that inner voice, or actions that go with that inner voice that you imagine in your mind? So perhaps just think about what you've done today, when you're making breakfast or when you were preparing for this lecture. What was in your mind? What were you thinking about? And were there a shape, colours, meanings to these actions if you have them, if you have these images in your mind as well? So I guess I'm really asking you, do you think in words or pictures? I definitely think in words with an inner voice, but I also think in images too, and perhaps sometimes they're related, perhaps sometimes they're not. So also with this reflective exercise, just think about yourself for a minute. Think about how you present yourself to others. What's the image that you present out there to the world? How do you represent yourself to the world? What sort of clothes do you wear? What sort of fashion are you interested in? What kind of styles do you have? What kinds of accessories do you use? Do you use makeup? Do you have badges? What kind of hairstyle do you have? All of these things, sort of social and cultural things, I guess, in our society, are how you present yourself to the world. So in a way, in this lecture, we're going to tap into these kinds of visual representations, of course, not of ourselves, but actually of what people think of society maybe, and particularly what people think of health issues and ideas around health. So let's just pad that out a little bit more now. Okay, so why are we interested in visual images as qualitative researchers, as social scientists, or as health researchers, or all of the above? Well, I guess the first thing to say is that visual images in our society, in Western metropolitan societies at least, are everywhere. We live in a world that privileges visual images. So we can think of photographs, film, television, drawings, diagrams, many other things as well. Of course, online as well now on the internet and various social media apps, as well as out there in society, newspapers, magazines, other images in the media, all that sort of thing. So as you can see there, Banks, who has written a very good book on using visual data in qualitative research, says this: images are ubiquitous in society, and because of this, some consideration of visual representation can potentially be included in all studies of society. So we're just going to pad that out a bit more in this first introductory part of this lecture. Banks also says that the study of images, or one that incorporates images, studies that incorporate images in the creation or collection of, in our case, qualitative data, might be able to reveal some insight that is not accessible by any other means. So we're going to see some examples of that as we go along. And sort of related to that point, McPhail and Kitchen say that visual methods can provide a complementary viewpoint to word and numbers-based research, another way of communicating our findings, if you like. So that's another reason, as researchers generally, but also as qualitative researchers, and for us as qualitative researchers in health, that we might be particularly interested in visual methods. Okay, so just to pad this out a little bit more, this first point really of Banks, that images are ubiquitous and they say something about society. And as social scientists, as qualitative researchers, that's one reason at least why we would be interested in images. So this is an image that I took on my phone late last year, just around the corner from where I live in the inner west. And as we all know, the coronavirus pandemic is something that's been very much part of our society over the last year or two, whether we like it or not. And we can see here a visual image from an unknown street artist on a transformer box just around the corner from where I live, saying something about this. So you can see there, COVID lies with the S having a $ through it. So one of the points about using visual images in qualitative work is that they can be hard to interpret, perhaps a little harder than words and text, which we also use a lot in qualitative research, as you now had some experience of. So visual images can be even harder to interpret, but we have various ways of dealing with that if we use them in our research. So here, perhaps, if we're looking at that $ symbol on the S, perhaps this particular person, of course, we don't know, we're guessing, but maybe this has got something to do with big pharma, perhaps, and perhaps this particular person thinks that it's some kind of exploitative notion that's going on with COVID. Perhaps this particular person doesn't think that the coronavirus is necessarily an illness or a virus that's out there in the world, or perhaps one that might be over-exaggerated in terms of its spread and its consequences. These are the sorts of things that we can start thinking about when we're looking at this visual image. So as Julie said to you in the very first introductory lecture, in qualitative work, we want to be open. We want to sort of explore and think about what this means in a social and cultural context. So we might also think about people who are opposed to vaccination. Perhaps this image has something to do with that. Perhaps this has got something to do with rising distrust in society about science in general. So, you know, virology in particular, epidemiology in particular, which the pandemic might also have been highlighting. It might also have, so we might say something about science and evidence and the mistrust of science and evidence more generally. Of course, for us, we're in the School of Public Health in this unit. So we're interested in, I guess, community responses to infectious diseases. So perhaps we're interested in this image because it's saying something about people's mistrust and those sorts of things, perhaps governments in general as well. So there's a lot of different things that perhaps we could consider with an open inquiry about what this visual image might represent. And there might be ways that we can get beyond guessing. But for a start, I just want you to sort of perhaps find an image yourself, maybe on your phone or in any of those other media or other sources that I've mentioned. Just have a look at it, maybe if you can find one that's health related, and just have a think about what some of those issues might be in there in that image, preferably a health one, but if you can find one that sort of speaks to wider society issues in general, that's what I want you to start thinking about with visual images. Okay, so main uses of visual data then, just in this introductory part of the lecture. So we can use them to analyse public representations of ideas, identities or events, particularly things like newspaper or television images, particularly news items and such things. So they can be used to sort of study what wider society thinks, media thinks, various representations of current issues and events, and for us, particularly interested in health ones, of course. As I've already hinted to, they can be used to illustrate meaning. So in some examples we're going to look at, we'll look at getting participants to draw or take photographs for us in a health context. And in that way, a drawing or a photograph can also elicit a response from participants. So we might use them images to elicit a response in interviews or focus groups, or images might be used to track action as part of an ethnographic or observational research project. So you've now had some lectures in observation, so you know a little bit what that's about. Ethnographic research or ethnography is what anthropologists do, where they study societies and they may use various data collection methods, of which images might be a part and can be quite an important part. So these are all ways that we can use visual data in our social research and, for us, qualitative research in health. So in the next part of the lecture, we're going to talk about some specific types of visual data collection methods. So I'm going to talk about photo elicitation or photo voice, give you an example of that. Also image production, where we get the participants themselves to perhaps draw something or take a photograph. So we'll be looking at that. These kinds of visual images are part of a wider family of qualitative research methods we call participatory methods. So there's a spectrum there. So in this case, we're getting participants to participate in the generation of data. But there are also other kinds of participatory methods where we might get participants to be involved in the study design, perhaps even an analysis, perhaps in interviewing, those sorts of things. But in this instance, the examples I'm going to give you, it will be participants generating visual data in some way, either a photograph or a drawing. And also just to note that these methods can be used on their own or as part of a mixed method approach with other methods. In our case, we're going to look at other qualitative methods, interviews, but they can also be used with focus groups, or they can be used with quantitative methods as well. So they can be used in combination with other things, as many qualitative methods can. Okay, so that's it for this lecture, and I'll move on to give you some examples in the next part.